I'm washing my hands. Knock, knock, knock. May I come in? He says yes. Hello, my name is Anna. I'm a student CNA. May I check your ID band? He says yes. Okay, thank you, Mr. M. So I saw that your call light was on. Is there anything you needed? He says he needs to use the bedpan. Okay, I'm gonna go gather my supplies. Here's your call light. I'll be right back. So I'm washing my hands. I exit the room. I gather my supplies. Wash my hands. Knock, knock, knock. May I come in? He says yes. Okay, Mr. M, I'm back with my supplies. I'm gonna go ahead and close your privacy curtain. And I'm gonna set up my supplies. I'm gonna put a barrier. And I have toilet paper, bedpan cover, bedpan, linen protector, hand wipes, and a bath blanket. Okay, so the first thing that I'm gonna do is I'm gonna raise your bed to a good working level. Then I'm going to lower the side rails. Okay, so now I'm going to sanitize my hands, apply gloves. Okay, Mr. M, so are you able to lift your hips up without any trouble? He says yes. Okay, Mr. M, so I'm going to uncover half. Okay, can you bend your knees for me, please? Bends his knees, says yes. Okay, on the count of 3, I'm gonna need you to lift your hips up. 1, 2, 3. Thank you, Mr. M. And I put the bedpan with the linen protector on to make sure it's centered. Okay, and now I cover him. Okay, Mr. M, so now I'm going to go ahead and put on a bath blanket for your warmth and privacy. Can you hold on to the bath blanket for me? He says yes. Thank you, Mr. M. I lower his linens to the foot of the bed. Fan fold them. Okay, so now I'm going to raise your head of bed just for comfort and so it could help you go to the bathroom easier. Are you comfortable, Mr. M? Are you in any pain? He says no. Okay. So I'm going to now remove my gloves, sanitize my hands. Okay, Mr. M, so now I'm going to raise your side rails up. I'm going to lower your bed to its lowest position. Okay, so here are your hand wipes and your toilet paper. Can you reach them? He says yes. I'm gonna leave them on your bedside table along with the bag where you could throw the trash away. You could use the toilet paper to clean yourself if you can. And here's your call light. You could press it when you're done going to the bathroom. And if you don't press it in 5 minutes, I'll be back to check on you. So I'm gonna go ahead and leave now that your bed is lowered to the lowest position, your head of bed is up. Okay, so would you like your curtains to be closed or open? He says closed, so I leave them closed. Okay, I'm gonna wash my hands, I exit the room. I see the call light goes on, so I wash my hands. I enter the room. Okay, Mr. M, so I'm gonna make sure the curtains are still closed. So I'm gonna go ahead and raise your bed to a good working level. I'm going to lower your head of bed, and I'm going to lower your side rails. Okay, so now before I start, I'm going to sanitize my hands, apply gloves. Okay, Mr. M, so I'm going to uncover this side, and I'm going to turn you to your right side. So can you put your right hand up, your left hand across your chest, and cross your legs for me, please? Thank you, Mr. M. On the count of 3, I'm going to turn you. And as I'm turning Mr. M, I'm going to grab the bedpan from the handle with just the bedpan from the handle, and I'm going to remove it as I turn him to the right side. Okay, so now I'm going to put the bedpan at the foot of the bed, and I'm going to place the bedpan cover on the bedpan. Okay, so now I'm going to clean Mr. M using toilet paper. I'm going to grab one piece of toilet paper and I'm going to clean front to back, down the middle first. I'm going to dispose of that in the trash. Then I'm going to grab another piece. I'm going to clean on one gluteal from front to back. Dispose of that piece. Grab another one. Clean his other gluteal fold from front to back. Dispose of that piece. Toilet paper, and then clean down the middle again from front to back. Okay, dispose of that in the trash again. Okay, so now I'm going to remove the linen protector. going to remove it, and since this linen protector is disposable, I'm going to place it in the trash bag as well. Okay, so now I'm going to remove my gloves, sanitize my hands. Okay, Mr. M, so now I'm going to turn you on your back now. On the count of 3, 1, 2, 3. Are you doing okay, Mr. M? Are you still doing okay? He says yes. Okay. So now I'm going to raise his side rails up, lower his bed to the lowest position. Okay, Mr. M, I'm going to go ahead and take the bedpan and inspect the contents. I'll be right back. So I'm going to sanitize my hands, apply gloves. I'm going to grab the bedpan. Okay, so now I'm going to go to the bathroom and I'm going to throw away the bedpan cover in the trash. And then I'm going to inspect the contents for any abnormalities like blood in the stool, or if it's like a liquid or anything like that. The BN looks normal. There's nothing abnormal about it, so I just dump it in the toilet. I clean the bedpan, dry it, and place it where it belongs. And most likely it stays in the restroom. Okay, so now I remove my gloves, sanitize my hands. Okay, Mr. M, I'm back. So now I'm going to raise the bed to a good working level. I'm going to lower the side rails. Going to sanitize my hands, apply gloves. Okay, Mr. M, so now I'm just going to put your blankets back on you. So can you hold on to the blanket for me? Thank you, Mr. M. So I'm going to remove the bath blanket. I'm going to dispose of it I'm going to place it in the linen bag, in the dirty linen bag. Okay, so now I'm going to fix Mr. M's blanket. Oh, before that I'm going to remove my gloves, sanitize my hands, fix this blanket. Make sure it looks nice. Are you comfortable, Mr. M? He says yes. Okay, so now I'm going to raise the side rails up. Mr. M, would you like your head of bed raised or lowered? And he says he wants it just lowered like that. Okay, and oh, I also forgot to ask, would you like your hands under or over the blanket? He says under. Okay, so I'll just leave it like that. Okay, and before I lower the bed, I'm going to the foot of the bed and I'm going to check the resident's alignment. The patient is aligned correct. His alignment is good. So now I'm going to lower the bed to its lowest position. Okay, Mr. M, so now I'm going to dispose of my dirty linen bag and dirt and trash bag, which were at the foot of the bed. And I'm going to place his toilet paper and hand wipes in his bedside drawer. Okay, Mr. M, can you reach your bedside table? He says yes. Okay, here are all of your belongings in case you need anything. Is there anything else you need help with or want me to do for you? He says no, that he's fine. Okay, so here's your call light. I'll make sure to go tell the nurse that you were able to go to the bathroom, and I'll be back to check on you later. Here's your call light. So I open the privacy curtain, I wash my hands, and I record, we check.